Happy Monday, everybody. This is Dr. Stephanie, your double board certified critical care physician who works with physicians that are struggling with their jobs, burnt out with their careers, or who just want some career advice. Through my books, webinars, coaching, and speaking, I help physicians discover alternative jobs and careers in medicine so that they can practice medicine on their own terms. Happy National Physicians Week to all of my physicians. I just want to take this time and give you a special shout out and let you know that I appreciate everything that you do. So in honor of National Physicians Week, I'm going to be hosting a series of Facebook Lives in which we are going to discuss some very important issues affecting physicians. Now let's just start off. Well, before we get started, I have a couple of favors to ask you guys. If you're watching this live, please just drop a line in the chat box, say hello, let me know where you're watching me from. If you're watching this on replay, please type the replay button. Please feel free to share this broadcast with anybody. If you like what I've said, press the like button. If you love what I've said, press the love button. And this is designed to be a conversation, so please feel free to put your questions and comments in the comment section. So like I said, this Facebook Live is in honor of National Physicians Week. And National Physicians Week was started last year by Dr. Kim Jackson and her organization, Physicians Working Together. So I would like to give a special shout out to Dr. Kim Jackson and thank her for all of her hard work that she is doing to advance the causes of physicians and to make sure that we get the recognition that we deserve. Well, this week, who's National Physicians Week for? Well, the name is self-explanatory, but I think I need to explain who this week is actually for. This week is designed to celebrate the accomplishments and contributions of physicians. Those of us who are medical doctors, those of us who have an MD or a DO behind our names and practice medicine in the United States of America as a medical doctor. It's not that we don't love anybody else, but everybody else has their week. National Physicians Week is our week. So why is National Physicians Week needed? Well, National Physicians Week is needed for several reasons. First of all, like I said, just to celebrate the contributions that physicians make to our patients, our hospitals, and our communities. Just to give us some recognition and a little pat on the back, because everybody likes to feel appreciated. And, sometimes we physicians don't feel appreciated because, we are sometimes painted in the media as being, money grubbers and greedy people. Sometimes we are painted as being the sole cause of the broken healthcare system in the United States of America. And I'm here to tell you that that's not the case. So this is a week in which we celebrate ourselves while we are discussing some of the issues that impact and affect physicians. But also, National Physicians Week gives us physicians a chance to tell our own stories, a chance to combat the public misconceptions about physicians and to combat some of the negativity that physicians receive, especially on social media. So this week is all about us because, America seems to kind of have a love-hate relationship with doctors. On the one hand, we're expected, and we do train for almost 10 years to learn our craft. We make countless sacrifices. We put the needs of our patients oftentimes before our own. We take on a huge economic debt and economic burden to train to be physicians. And we do care about our patients, and we do oftentimes put our careers first, which may or may not be necessarily the best things, but our careers are very important to us. But on the flip side, we are often viewed as selfish, egotistical, money hungry, and money driven people who only care about ourselves when nothing can be further from the truth. So this is a week in which we are celebrating ourselves. We are going to tell our own stories. We're going to discuss some tough issues. And this is a week in which we physicians, the MDs and the DOs who practice medicine, are going to celebrate and uplift each other. So like I said, this week I will host a series of Facebook Lives in which we discuss important issues impacting physicians. And tonight, we are going to talk about the economic impact of physicians. And this is important because oftentimes when the rhetoric comes to healthcare spending, healthcare dollars, the conversation often centers around how much money physicians make. Because of course, you know, we're all making millions of dollars and living in mansions and driving Lamborghinis to work every day, right? Wrong. So oftentimes, so much of the conversation about finances and money and healthcare seems to center around physicians and our salaries, and it places the blame on physicians, and it implies that the reason why healthcare spending is so high and healthcare costs are so high is because physicians make too much money. But what these discussions fail to talk about is the fact that physicians make a huge contribution to the economy of this nation. According to a study by the American Medical Association done this year with data from, I think, 2015, it shows that physicians contribute $2.3 trillion to the economy annually. That's trillion with the T, and that's every single year physicians on a whole contribute this money. Now, there's a little over 700,000 physicians in this country, but collectively, we contribute $2.3 trillion to the economy. We support 12.6 million jobs. So that means that each physician, on average, supports 17.1 jobs. So do you hear me? Each physician, on average, supports 17.1 jobs. That's a lot. Physicians, according to the AMA study, are responsible for over 1 trillion, that's with the T, $1 trillion in wages and benefits paid to workers each year. And so there are 736,873 physicians in the U.S. So that means that each physician on average is responsible for creating $1.4 million in wages and benefits for workers. So without going any further, you can already tell, you know, that physicians, based on this data from the AMA, from numbers as recently as 2015, each practicing physician in the United States of America is responsible for making a huge economic impact to their communities and to this nation. Physicians are responsible for $92.6 billion with the B dollars in state and local taxes. So that breaks down to $126,129 in state and local tax revenue generated per physician. That does not include the money that we pay. These numbers don't include the money in federal taxes that come out of our salary. This means that the jobs that we generate either directly or indirectly, the services and products that we provide directly or indirectly, that we are responsible for purchasing, that we contribute, each doctor, each practicing physician contributes $126,129 to the state and local tax. Let's see here. The economic impact of physicians is multifactorial. It does really kind of make sense once you think about it. Physicians create jobs. We have economic activities that contribute to the economy or to our state, local, and national economies. We pay wages to workers, especially those of you who are in private practice. Those other of us physicians who aren't private practice, you know, we generate enough revenue and provide enough medical services to support a lot of jobs. So physicians create jobs. We're responsible for jobs. We're responsible for economic activities. A lot of physicians pay wages to workers, state and local tax revenue, admissions to hospitals, ordering tests, writing prescriptions, hiring staff, buying equipment. paying for other services. So, and like I said, this study done by the AMA that has data from 2015. The study was released in January of 2018. This study didn't even account for the federal taxes that we physicians pay or are responsible for paying as well also. So, like I said, the multifactorial impact of physicians to the economy is very broad. So there was a quote in this article that I read. It said, economic output and wages attributable to physicians are higher than those who work in higher education, nursing, or community care facilities, or home health and legal services. So what does this mean? It means that we physicians, a lot of physicians, employ people either directly or indirectly based on our services that we provide. We provide a lot of jobs. We support a lot of people, and these people purchase goods and services and thus stimulate the economy. So why does this matter? Why does this matter? Physicians have a tremendous economic impact on our communities, but like I said, before this study came out from the AMA, there's little rhetoric in public discourse about the economic benefits that physicians provide to the communities. All too often, like I said, when people talk about money, they talk about healthcare, they talk about healthcare costs. We physicians are made to be the bad guys. Like I said, everybody thinks that we are generating seven-figure salaries and that we are sitting up, playing golf every day in the spa, not doing any work. And what's the reality of the situation is physicians contribute trillions of dollars to the national economy, and each physician is responsible on average for 17 jobs. So this is huge. So we physicians kind of need to take back this conversation in terms of, healthcare expenditures and say, hey, we are not the problem. We are the only people who are generating revenue. So we have to come up with a solution collectively, and blaming doctors is not the answer. But another reason this matters is because, we all know that there is a true shortage of physicians. And so the physician shortage not only threatens to negatively impact the care of people, but the shortage of physicians also can blunt the economic development of a community, because based on the data that I just presented and the numbers that I just showed, physicians employ people. Physicians generate revenue for their hospitals, generate tax revenue for their municipalities. So the physician shortage not only impacts delivery of care and quality of care, physician shortage also blunts the economic development of a community. Now, physicians also have a huge economic impact on hospitals, a positive economic impact on hospitals. And this is one of the worst kept secrets, or the best kept secrets, because once again, when we start talking about cost and healthcare cost, everybody wants to blame the doctors. But look at this number right here, and this number blew my mind. And this number comes from, I think, a study from Merritt Hawkins, and this data is actually pretty old. It's back from 2013, but Merritt Hawkins did a study, and they basically found that each physician, on average, generates $1.4 million in revenue for their affiliated hospitals each year. Let me say that again. Each physician, on average, generates $1.4 million in revenue for their affiliated hospital each year. I don't know many physicians making that kind of money. I don't know many physicians or any physicians making $1.4 million and taking that money home and putting it in the bank. But according to this study, these physicians are generating this kind of money to their hospital, their affiliated hospital. They're generating the money from hospital admissions, ordering tests, inpatient and outpatient tests, inpatient and outpatient procedures. So this is huge. Now, Anila, Dr. Cord, hey, Dr. Cord, how are you? Now, look at this. This is what blew my mind. Family practice physicians generate, on average, $2.6 million in revenue each year for their affiliated hospitals. Let me say that again. I'm going to give y'all a minute. Where my family practice doctors out here, I'm giving y'all a huge shout out. This is some important information for you guys to put in your arsenal. Okay? Family practice physicians generate, on average, $2.06 million in revenue annually for their hospitals. I don't know any family practice doctors making that kind of money. As a matter of fact, family practice doctors are some of the worst paid physicians, overworked physicians. So my family practice doctors, while that hospital administrator is trying to get you to squeeze in and to see more patients and to shorten the amount of time you have to see them, you might need to respond to this and show them how valuable you already are. So like I said, this data is from the 2013 Merritt Hawkins study, and I have the numbers for the other specialties. Okay, so just bear with me. Okay, so annual revenue generated for the hospitals, okay, for orthopedic surgery is $2.6 million a year. Invasive cardiologists generate on average $2.17 million a year for their hospitals. Family practice physicians, like I've emphasized, generate on average $2.06 million a year for their hospitals. Internal medicine doctors generate $1.84 million from their hospitals. Hematologist oncologists generate $1.76 million annually for their hospitals. Neurosurgery doctors generate $1.684 million annually for their hospitals. OBGYN generates $1.4 million annually for their hospital. Each OBGYN doctor generates this kind of money. And Dr. Cord, I can guarantee you, I know you're not making anywhere close to that. But people trying to tell you how to do your job, and they're making money off of your back. You're generating on average $1.46 million according to this data a year for your hospital, and your salary is not even close to that. Urology the average urologist generates $1.428 million annually for their affiliated hospitals. GI, the number is $1.385 million annually for their hospital. Non-invasive cardiologists generate on average $1.2 million in revenue for their affiliated hospitals. The number is $1.17 million for nephrology. For pulmonology, $1.0 million on average generated annually for their hospital. Pediatricians, $787,000 annually generated for their affiliated hospitals. Ophthalmology, $725,000 annually revenue generated for their hospital. And neurology, $691,000 annual revenue generation from their hospital. So these numbers kind of blew my mind, because that is one of the best kept secrets, because people aren't talking to you about this, aren't saying, you know what, you actually, as an invasive cardiologist, generated, $2 million for us for this hospital. Dr. Afridi said, let's see, thank you for joining. Let me see your comment. Hospitalists, wow, would love to see how they come up with that, especially with the readmission impact starting to be felt at hospitals. It says IM, $1.84 million. So what, is what we're generating. And I don't know about like the readmission impact, but you can kind of do the numbers, for a hospitalist. I'm an intensivist, so based on, the dollar value of the RVU, if you're seeing, 15, 20 patients a day, if you're doing some procedures, if you're working, 15, 20 shifts a month, you generate a lot of revenue for your hospital. But what I found very interesting is that a lot of the primary care specialties generate more money in revenue for their hospitals than a lot of the subspecialties do. But across the board, primary care doctors are not compensated as well as some of the specialists are. So what does that say? So like I said, my family practice doctors on average generate $2.06 million for their affiliated hospitals every single year. And nobody's having these conversations with us. They're just telling us we have to see more patients, and we have to see more patients in a shorter amount of time. So let's look at this right here. Now, like I said, physicians generate a lot of money for their hospitals, as we have been talking about, but 9 times out of 10, well, 10 times out of 10, physician salaries don't reflect the money that they generate for the hospitals. I don't know any family practice doctors bringing home $2 million. As a matter of fact, most family practice doctors don't even break $200,000. I don't know any pediatricians, although pediatricians are generating $750,000 in revenue for their associated hospitals. I know no pediatricians making that kind of money. As a matter of fact, I know pediatricians making $90,000 a year. So what kind of sense does that make? So our salaries do not reflect the money that we're generating for our hospitals at all. So why is that? It's maybe because physicians are so busy generating revenue that supports other people's jobs. Now, we all know that there's a shortage of physicians, and unfortunately, the number of physicians hasn't really grown in the past couple of years, but there's one group of hospital employees who have experienced a tremendous growth in their employment opportunities in the hospital, and you guessed it, hospital administrators. So for every one physician, there are 10 hospital administrators. Do y'all hear me? So for every one physician, there's 10 hospital administrators. So that's maybe one reason why, so many hospitals are top heavy. And so those hospital administrators, and I'm probably going to get in trouble for saying this, but this is why I do locums, like a lot of these hospital administrators who are telling you how to run, how the office needs to be run, and how you need to schedule your procedures. Our salaries are supporting them. So each one of us is basically supporting 10 hospital administrators. Okay? And this data comes from a 2013 report in the Harvard Business Review. And it says that the number of physicians has remained fairly constant, but the number of hospital administrators has exploded over the last several years. So there's 10 hospital administrators for every one doctor. So as we've talked about, physicians provide patient care, we contribute to the economy, and we generate a lot of money for our hospitals. We generate a lot of hospital revenue. So what does all of this mean for you as a physician? Well, first of all, I'm saying all of this because I want us to be encouraged. And the reason I want us to be encouraged is because so much of the time we are beat down and made to feel as though physicians are the problem. Healthcare, costs are so high because of those darn physician salaries. But that is not true. As I have shown, physicians generate an average of $1.4 million in revenue to their affiliated hospitals. So we are the ones that are making the money for the hospitals. So number one, be encouraged that physicians are not the problem. We are not the reason why healthcare expenses are so high in this country. Secondly, I want us to know our value. I want us to know what kind of value we bring to our communities. I want us to be encouraged about the fact that we save people's lives, and we provide jobs, and we support the economic base of our communities, and we support the tax base of our communities, and we generate almost over $1 million a year of revenue for the hospitals that we are associated with. So be encouraged, know your value. And I also want us to know our worth, because based on these numbers here, it seems like some of the physicians that are the least paid physicians are some of the physicians who are generating the most revenue for their affiliated hospitals. Know your worth, but also you need to know your numbers. Get your own numbers. Figure out how much money you're generating for your office, for your clinic, how much money that you're generating for your affiliated hospital. For my practice owners, you need to know more about that and know your exact numbers, because medicine is a business. And also, I just want us to be empowered to take control of our careers. Know that whatever you do as a physician, whatever role you play, whatever type of physician you are, that you are valuable. You are valuable to your patients. You are valuable to your community. And whether or not your hospital actually tells you, you're actually valuable to your hospital as well too, because physicians generate revenue for their hospital. So like I said, I want you to be encouraged. I want you to take control of your careers. I want you to know your value, to know your worth, to know your numbers. Now, in honor of National Physicians Week, I am running a nice little special for everybody, because everybody keeps asking me to teach them about locums and doing locums work. Well, guess what? Your requests have been answered. Hi, Dr. Uchi. How are you? Thank you so much. I am offering a free Locums 101 webinar in honor of National Physicians Week, and this webinar will be on April 16th at 8 p.m. And so, in order to register, I need you guys to go to www.locums101.com for this free locums webinar that I'm hosting just for you guys in honor of National Physicians Week. So I do want to take this opportunity to thank you all for coming. Please join me tomorrow at the same time, and we will continue our discussion for National Physicians Week, because we're going to continue to talk about things that impact us, but we're going to also continue to celebrate the contributions and the achievements of those of us who are medical doctors, who are physicians in this country. Thank you so much. Please feel free, if you have any questions, to put them in the comment section. If you have any comments, please feel free to share, and we will see you soon. Thank you so much. Bye-bye.